we are not making it because we are waiting for the shoe to drop. Because when that shoe drops, stroke happens. When that shoe drops, heart attacks happen. When that shoe drops, we're talking about putting you on dialysis. We do not need to wait until the shoe drops when it comes to our healthcare. No, we're not. Right? We're going to be selfish. Right? We want to be here as long as we can, as healthy as we can. And to do that, we have to be what? Aggressive with the prevention, not with the treatment. All right. So we're going to talk today about why and how routine healthcare seems to fail so many men. This is Men's Health Awareness Month, so we obviously the spotlight is on us this month. So we're going to talk about why the fact that 40% of y'all are delaying getting your routine health checkup, and unfortunately, when you do so, that routine health checkup is causing a problem. Right. Again, I'm yours truly, Dr. Barry Pierre. I'm the host of Medicine Mondays, and we're going to talk this month, obviously this episode, but definitely this month, we're going to talk about men's health awareness. But today we're going to talk about the routine checkups that you guys should be getting, when you should be getting them, right? Because again, I don't want you, right, to be in your 20s, your 30s, and 40s and have no clue what checkups you're supposed to do. Because when you get to 40s, 50s, 60s, when you get older, right, and all of a sudden things start breaking down, I want to make sure you're ahead of the game instead of behind the game. All right, so here's the issue at hand. Men die on average about 5 years younger than women, right? So women are outliving us. And yes, I know some people are going to be like, oh, well, men live more dangerously and whatnot, and they do more dangerous things. Yes, that answer is there. 100%. We won't disagree with that. But what's also happening is that they're not getting what I like to say, y'all know me, the routine checkups like they're supposed to get their routine checkups. And they're not getting them when they're supposed to get them. They're getting them late. And when they do get them late, right, unfortunately, even at that time, when you do all the things right, the system at hand is failing them, right? So we're going to talk today as far as like, how do I know based off like how old I am, my next birthday, what should I be getting done to make sure I am ahead of the game, right? Again, I like this fact, right? 64% of men avoid going to the doctor as long as possible, right? According to the Cleveland Clinic survey, 64% of y'all, right? Y'all, right? Again, this is I'm putting the spotlight back on us, right? 64% are avoiding just going to the doctor, just going to the doctor, right? You have to be forced. I talk about this all the time. Two of the main reasons why men would see me when I was doing outpatient medicine is that there was some sexual dysfunction, right? So they wanted to have some sex and they couldn't have some sex, right? So they wanted one of those medications, those pills, right, to help them have some sex or get some hormone levels to check. Or there's a family member in that waiting room, in the car, sometimes in the exam room with me saying, hey, this person needs to get a checkup because he's been avoiding you, doc, and I'm making sure that don't happen, right? Because I usually take care of family members, right? So those were two of the biggest reasons why. It was almost I wouldn't say shock. It was a pleasant surprise when men would just schedule their appointment because, hey, you know what? I need to schedule my appointment. Like, that's me. I'm the type, my birthday is centered around my physical annual exam date. Like, I know, hey, my birthday is coming up. That tells me, hey, it's time for my annual physical. That's how I look at it, right? Because I want to make it to another birthday. Y'all understand that? Right? And if you want to make it to another birthday, you know what you can do, right? Make sure you are subscribed to the channel, right? Y'all know I was going to do this. Make sure you're subscribed to the channel, hit the notification bell button to make sure that we can get you to your next birthday in the most happiest, healthiest position you could be in, right? So back to the schedule program, right? If you want to make it to your next birthday, man, right, you got to get your checkups done, right? Like there is no, oh, nothing's wrong with me because I haven't gone seen a doctor in a decade, right? Like, no, you're just avoiding the thought that something may be wrong with you, right? And that's what I'm trying to avoid, right? I want you to get the answers. I don't want you to just kind of live in this space in your head that tells you that everything is fine because you've never had a doctor you've seen to actually prescribe you medications or do any tests to tell you everything is not as fine, right? So this is a big issue as well, right? Like, and I like this aspect of it. Insurance companies want fast visits. Doctors get about 15 minutes, right? 15 minutes, right, on average to see a person. And what I think is happening because of that system that is getting patients in and out, And then men, right, because we like to get in and out, we're just assuming like, all right, man, if the doctor doesn't need that much time to see me, if they're trying to get me in and out the game, guess what I can do, right? I can avoid them for a month or two or three, right? Like I could do that, and like that's no, you're not gonna do that here, especially if you follow this channel. That is not going to be the recipe that you follow moving forward, right? So let's talk about, and I like to talk. Y'all know me, like I like to kind of bring it home, right? Again, I remember I think I was a second year medical resident, right? And it was one of the first times. That's when I started realizing men don't like going to the doctor. Again, I'm in the healthcare field, right? I want to be a doctor, right? So I just assume that people like going to the doctor. I didn't even realize that it was a thing not to go to the doctor till I was in residency, right? Because then I started talking to more and more men, more and more families who, again, whose wives would bring them, whose sisters would bring them, whose mothers would bring them and say, hey, like so and so, I don't even know I'm here, doc. Like so and so is the reason why I'm here. And I always get the, oh, everything is fine. I don't take any medications. And when I was a resident, I used to think, oh, okay, everything's good. The person is fine. Doesn't take any medications. And then when I would tell my attending would say, so when's the last time they saw a doctor? And that was a question I did not have in my back pocket. Right? You learn some things as a physician that you put in your back pocket when you need to bring it down. And it was one of those questions I just did not have, right? Because I did not think that the reason why this person didn't have any medical problems and weren't taking any medications wasn't because they were all healthy. It was because they never went to go see a doctor to tell them that they should. So I go back. So I had to go back into the room and say, hey, one more question. When is the last time you saw a doctor? And they did one of these things, right? They looked up in the sky, right? For those who my podcast listeners who can't see what I'm doing, right? Again, make sure you subscribe to the channel. Head over to the YouTube page. Looked up in the sky, and I was like, oh, he had to think about it, right? And the fact that he could not even remember when's the last, like he couldn't even give me a ballpark. He's like, yeah, doc, I think it was about 10 years ago. Like, imagine. I'm like, huh? Like, you haven't seen a doctor in 10 years? Right. So, of course, now my interview questions are back on. I'm like, well, if you haven't seen a doctor in 10 years, like, how do you know you don't have the medical problems? Because I feel fine. And I think that those two words, right, feel fine, right, or three words, I feel fine, is part of the reason why a lot of us are, especially men, are dying a lot younger than women, right? Because we walk around with this "I feel fine" attitude, and our body is like, "I am hurting. Go see a professional," and we're ignoring it, right? So we're not going to ignore that today. We're not going to ignore that today, right? So let's talk about let's break it down, right? We're going to break down from an age, like decade perspective on what type of testing, especially men, that we should be getting done, right? And it starts, you may be saying, all right, doc, what does it start about? 25, 30? No, like the second you hit your 20s, really 18. Once you're 18, for those who know, I'm an internist, right? So I see 18 and above, right? Second you're 18, there are certain things you should be doing, right, to make sure that you make it to the next decade, right? So as 18, one of the things we always check for, and this may seem kind of self-explanatory because if you actually go see a healthcare provider pretty regularly, it always happens, right? So in your 20s, things we want to look for, right, is our blood pressure, right? We want to start checking our blood pressure. Whether you're going to the doctor, you check your blood pressure. Whether you're going to the pharmacy, you're sticking your arm in that blood pressure machine that a lot of y'all walk by and never check, right? Again, I'm not telling on nobody, right? Don't tell on yourselves, right? When's the last time you checked your blood pressure? Put in the YouTubers, put it in the comments, right? When's the last time you checked your blood pressure? Exactly. So checking your blood pressure, making sure you have an adequate history of what your blood pressure looks like is a good deal when you're in your 20s, right? Because obviously a lot of things happen, work, stress, life, like a lot of things happen in your 20s. You want to make sure your blood pressure is on point. Your BMI and your weight, this is definitely when you want to be very poignant on, focusing on your BMI and your weight, even though what's so wild. I just saw I'm not sure if it was a CNN clip or something, right? And we might have to talk about that, right? Where you got these teenagers now who are taking like testosterone, right, to get physically fit, right? Like that's a whole different conversation we got to have. Yeah, we're gonna have a different conversation about that. But like, that just popped in my mind, right? Checking your BMI, checking your weight, and then doing self exams as far as testicular exams, breast exams, right? So again, in your 20s, right, you should have a feel for what your body is like, right? Self exams, right? You should have a feel of your weight, like your management of your weight, and more importantly, you should know, right? Hey, what's my blood pressure rocking with, right? Those are the things, right? So you see, I didn't mention any lab tests or anything yet, even though around this age, yes, you are getting lab tests, especially because family history is still a big deal. Family history is still a big deal. So you should know in your family if you got some diabetes. You should know in your family if you got some cholesterol. You should know in your family if you got some things there. But obviously, overall, systemically, we want to make sure those three things are encompassed, right? In your 30s, what should we be doing in your 30s, right? This is when we really start, the family history really starts playing a factor. Right. And this is when, obviously, like I said, before, like every once in a while, we're just checking to see what our blood pressure is looking like. Now, you should have this almost every year, like on a quarterly basis. You should know exactly what is my blood pressure rocking with. Right. We're being much more aggressive with our blood pressure and blood pressure control in our 30s than we were in our 20s. In our 20s, we said, hey, with our BMI and our weight, let's see if diet and exercise can help kind of clear this up. In our 30s, yes, diet and exercise is still a thing. Yes, diet and exercise is still a thing, but we understand that as y'all get older, right? Sometimes you need a little support, right? So again, making sure your blood pressure is on point is extremely important, as well as, again, when I kind of hinted at it, your diabetes and your cholesterol, right? All of a sudden, those genetic issues that may be playing a role, or more importantly, the social issues, right? Especially if you've been eating and drinking and doing all kinds of stuff for almost 30 years, right? Guess what? This is when it starts catching up to you, right? So making sure your diabetic numbers are on point, your blood pressure numbers are on point, your cholesterol numbers are on point, right? This is the time where we really start looking at lab work, right? And start like noticing, like, all right, what is the labs looking like right now? What is the kidney function, liver function? That's when your doctor is really going to be more on point in that aspect here. So think that's what happens in your 30s, because your risk factors definitely increase. In your 40s is when we start really thinking about, hey, you know what? Let me make sure the heart is on point. So heart related risk management, your screenings, right? When now we're in our 40s, right? So now we're thinking about our cancer related screenings. Colorectal cancer is the big one. Starting at the age of 45, if you got an average risk, your eye exam, your hearing. And remember, we're still doing all of the things we should have did in our 30s and our 20s, right? We're still making sure our diabetes is under control, our weight's under control, our diet, our vaccination, screenings. We're still doing those things here, but now we're just building upon it, right? Like as a 20-year-old, I'm not necessarily checking you for cancer, right? Like outside of testicular cancer, because that's when that age of distribution actually happens. But like colon cancer and stuff like that, usually prostate cancer, usually not checking for it at 20. 40, 100% I'm checking for it. At 40, in your 40s, I'm 100% making sure you're not walking around, especially, and again, obviously family history plays a role. And the reason why I say family history plays a role, because if you have a family member, and I talk about this all the time, if you have some family members, right, who've gotten colorectal cancer, gastric cancer, some type of cancer in their 40s and 50s, guess what age? You think I'm going to wait till you're 40 and 50 to check on you? No, sir. We're moving that down, right? So all of a sudden that scaling range kind of shifts for you depending on your family history. That's why it's so important to know your family history. But again, we're assuming great family history, everything is squeaky clean. 40s and 50s, during your 40s is definitely when we're doing our colorectal cancer screening, when we're doing the eye test, earring test, prostate test. We're assessing for heart rate, heart disease risk factors, right? So we're doing all of these things here in our 40s, right? Because again, right, we want you to get to your 50s, right? All of our game plan is to try to get you to the next decade, because a lot of us are not making the next decade. A lot of us are allowing our health, right, to cause us so many problems that even if you do make it in the next decade, you're decrepit, you're old, you're not yourself, you're not active, you're not doing all the things productive to your own self, right? So that's an issue, right? In your 50s, again, we talked about colorectal screening, bone density exams. We're making sure, like from a social standpoint, are you a smoker? Any history of smoking? We might check for cancer in the lungs. We might check for abdominal, aortic exams, right? These are some things that we do, like especially for my smokers as well too. Don't smoke. if you're part of this lunch and learn community, one thing I've been saying for like decades now is like stop smoking, right? Like there's no benefit from smoking. There's none. There's not even a good social benefit for smoking, right? Y'all not even that social, right? No benefit in smoking, right? Get it. And I understand sometimes they got y'all hooked. The marketing was great, but now that now that you follow Dr. Barry Pierre, right, there should be no smoking, right? None of that smoking, right? Get that smoking up out of here, right? So again, when we think about screenings, right? When we think about prevention, when we think about getting our checkups, a lot of it is I got to prevent the thing. I don't want you to get these tests done when you start feeling symptoms, then that defeats the purpose. That just defeats the purpose. I want you to get these tests done before problems arise, which is why, again, we're aggressive in our 20s and doing tests and labs in our tests, which is why we're aggressive in our 30s and doing things, right? We're aggressive in our 40s, right? We're being aggressive, right? Because it's much easier to be progressive on the prevention side than to be aggressive on the side of treatment. I hope you understand that. Much easier to be aggressive on the prevention side than it is on the treatment side. Because once you get to the point where we got to start treating some things, all of a sudden you have less options. I got a lot of options when I'm trying to prevent some things. I got a lot of ways to do things when I'm trying to prevent some things. I don't have that same ability when I'm trying to treat, right? I'm usually pigeonholed with what I got to work with when I'm trying to treat some things. But when I'm trying to prevent it, I got some ways to kind of move around this. And that's where I want you guys to get to, right? I want you guys to be able to move around some things here, right? Because that's the problem at hand. That's where we keep getting into trouble. And I don't want us to get into trouble, right? I want us to live as long as the women, right? I want us to live as long as the women from that standpoint, right? So, y'all know me, right? Y'all know a big thing for me, right? Is especially as we, reason why I like months like this, right? Mental Health Awareness Month, is that, again, the focus is there, the camera, the lights are there. But more importantly, I want y'all so that when y'all not listening to this during the Mental Health Awareness Month, like you're still focusing on like, all right, what did Dr. Pierre say? I got to take care of. It's December now. Like I know Dr. Pierre said he usually gets his annual checkups around this time, around his birthday. Like so it's important for us to recognize, y'all, right? It's important for us to recognize that if we are going to do these things, right, we have to be proactive for it, right? Gone are the days of us waiting for things to happen, waiting for the shoe to drop. Because that's like we're not making it. And that's just the reality at hand. We are not making it because we are waiting for the shoe to drop. Because when that shoe drops, stroke happens. When that shoe drops, heart attacks happen. When that shoe drops, we're talking about putting you on dialysis. We do not need to wait until the shoe drops when it comes to our healthcare. No, we're not. Right? We're going to be selfish. Right? We want to be here as long as we can, as healthy as we can. And to do that, we have to be aggressive with the prevention, not with the treatment, right? We have to do that, right? More importantly, right? So again, just a quick scenario, quick follow-up, right? Remember, right? What do we do in our 20s, right? Man, drop that in the comments, right? Drop it in the comments. What are we doing in our 20s? What are we doing in our 30s? What are we doing in our 40s? What are we doing in our 50s, right? What are we doing? Because the end result, right? Because I don't want us to focus on the stuff that we have to do, because obviously I do. But understand what is the end result? The end result says I get to live longer. End result says I get to, be happier with my family. I get to be happier with just the life I live when I get older, right? Like that's the end result, right? Like the end result is the destination when I do these things correctly is going to be a much better outlook than when I don't. Unless you want to be 50 years old, 60 years old, and you've already had a heart attack or two. Unless you want to be 50 years old, 60 years old, and now you have this aggressive cancer that you didn't manage because you just avoided the screening. Unless you want to be that. But I can assure you that the people who are listening to this don't want that. Like, y'all don't want that. Y'all don't want to have to deal with late stage cancer. Y'all don't want to have to deal with late stage effects of high blood pressure, high cholesterol, diabetes, right? PAD. Like, y'all don't want to have to deal with these late stage effects. I know it and you know it. So now that you know it, what are you going to do, right, to make sure that I'm doing what I need to do, right? So again, for the men this month, And for the women who are watching this and who have some men in their life who needs to watch this, make sure you share this out to them as well, man. So you guys be blessed, and y'all have a great evening.